lots of questions were brought up during that, so let's talk to Dr Jo Mountfield, who's the Vice President of the Royal College of Obstetricians and Gynaecologists, who joins us from Winchester. Good to have you with us this morning. I'm sure you must have heard some of that report, but we'll get through a couple of questions. Could you clear up what the guidance is now when it comes to who can be in when a woman is giving birth, who can be in the room with her?
So we've got really clear guidance from the college and from the Royal College of Midwives as well, that it's really important for women to have a birth partner with them, and also to try as much as possible to respect their birth choices in terms of the sort of unit that they'd like to go to have their babies. We know that's really important for women because if they're supported in labour, they're likely to have a much less anxious time. And let's face it, these are really anxious times for a lot of pregnant women, as you've already said. So really, the guidance is clear. You are allowed to bring in a birth partner, but it is one birth partner with you, and they need to be well. Obviously, if they're not well, then they won't be allowed to come in and stay with you while you're having your baby. We are suggesting to people that they think about a backup person. In many units, they will allow somebody to come with you. Clearly, I heard the lady in the film who was disappointed that our mother wouldn't be able to come, and I think those are the sorts of issues that people need to think about. But if you have someone else who can come with you, if your partner is not well, then that also would be absolutely reasonable for most of the maternity units.
Jo, this question from Mia, who is 38 weeks pregnant, she asks, if the virus does peak in the coming weeks, will that mean she won't be allowed a birth partner during labour? She says she has been told to prepare for no one to be allowed with her.
Well, that's certainly not our guidance at the moment, and we will do absolutely. All the units are really determined. The NHS is really stepping up to the plate and absolutely determined to try and support women through this as much as they can. So that would be a really draconian step to take, and that's not one that we're recommending. But clearly we need to carry on looking at the evidence, and we are collecting data about the outcomes of pregnancy with women who've had COVID-19. And once we have more of that evidence, that may change, but not at the moment. And so I think people need to be reassured at the moment that we are going to support them as much as possible so they can have a birth partner, because it really is important, really, really.
It's all good information, this, and very useful to answer specific questions. This one is from Shelley, 35 weeks pregnant. We should say every time, shouldn't we? Congratulations. It's a wonderful time, isn't it? She is asked if her partner can cut the cord, hold the baby, and how long he can stay after the baby has been born. Any changes there?
So all those things, if a partner and mother are well, they will be able to have exactly the normal care that they should have when they go in labour. So yes, holding the baby, yes, they should be able to cut the cord, all the usual things that you would do if that's your choice when you go into labour. In terms of how long the dad can stay, that is variable in different units, I'm afraid, and it is a matter of having a conversation with your individual units. So I know in some places that they're happy for dads to stay on afterwards because they have the facilities to be able to accommodate them with mothers, and they're staying through. In other places, they are not. They have not got the facilities for dads to stay, and so they are asking them to leave after labour. So I can't give you a chapter and verse about every unit, maternity unit in the country, because it is variable depending on their facilities, and also to some extent how much of a problem they've got in their particular area as well. So that is affecting the individual unit's guidance to parents. So keep in contact with your midwife, keep in contact with the unit, and they will be able to give you precise information for your particular area.
I mean, that kind of answers Jodie's question, who's 36 weeks pregnant. Congratulations, Jodie. Who was worried if anything were to happen untoward, if her partner would be able to visit her and be able to bond with the baby. But what it also raises is a question from Natalie, who says, and as you say, it depends on the health trust and the hospital and the situation. Natalie's asking if there's likely to be a shortage of doctors or rather equipment on the delivery suite.
I don't think equipment in itself is going to be an issue. In terms of the medical staff, then obviously we have really good plans in place, and all maternity units have good plans in place to try and ensure that we have the safest possible care, especially on the delivery suite. And in many units, we have both obstetricians and gynecologists who usually do both parts of the specialty. And at the moment, we have reduced the services for women in the areas of gynecology. So a lot of elective gynecology is not taking place at the moment, so that we can redirect those resources to make sure that we're still giving excellent maternity care. So yes, there are shortages, and that is causing some issues, undoubtedly, but we do have extra resource, and we are absolutely committed across the whole country to provide that for pregnant women. And as a college, we've written guidance around staffing as well to try and help people make the best use of those precious resources.
Jo, just one quick question. Of course, partners so important at this time for mothers. Yeah. Paul has got in touch, expecting their first child next month. Congratulations, Paul. His question about what to do once restrictions begin to ease and bringing the baby home. What any particular concerns about that next step? Most natural thing in the world, everything's gone well, come home. But what concerns are there, and what's the advice?
Well, we know that there's a very low risk of babies of getting COVID-19 and being seriously unwell. And I think that's really important to say. And I would say the same for pregnant women as well, in terms of reassurance that actually most women who get this will have a mild or moderate illness rather than being seriously unwell. But in terms of the baby, obviously at the moment, if you're bringing your baby home, you need to carry on with that social distancing. It really isn't a good idea to have to invite people around to your house at this point at all. We're none of us supposed to be doing that. And so back into the family environment, stay within the family environment, stay within your own household. That is the sensible things to do at this stage. And as things start to hopefully de-escalate, we don't know how long that will go on for. But again, it's about being sensible in terms of not inviting everybody for a massive party the first weekend that everything maybe is improved. You've got to be sensible. You've still got a baby and a mother to look after. So, stay in isolation until you're really sure that everything is okay. And certainly don't go into contact with anybody who's got any symptoms that might be related to the virus.
Jo, thank you so much. That's Dr Jo Mountfield, consultant obstetrician.